Heat stroke is the next emergency we will touch on. Some pet owners are not aware of the severe danger imposed by the scorching heat of the sun. Animals left in cars, dogs left outside without adequate shade and water, and dogs overworked in the heat of the day all readily lead to the pet overheating or heat stroke. When their body temperature rises several degrees above normal, they often will exhibit signs of heat stroke, such as panting, severe lethargy, and sometimes vomiting and diarrhea. Prevention of this condition should be a regular part of our client education. This emergency can often be avoided if the pet is supplied with plenty of fresh water and shade from the direct heat of the sun. Be sensitized to callers with pets that may be overheating when the temperatures outside become warm. First aid for heat stroke involves several immediate steps the owner can take. First, remove the pet from the direct heat. Next, offer them fresh water to drink if they appear thirsty. Don't let them consume too much, as this may make them sick as well. Next, begin the cooling process by hosing them down with cool water. Draping them with a cool, wet towel and turning a fan on them may also help cool their body temperature. You should not attempt to use an ice bath, as it is very easy to overshoot their normal temperature and end up overcooling them. Have the owner take the temperature every 5 minutes if possible. This can be done by inserting a lubricated thermometer rectally 1 to 2 inches for 2 to 3 minutes, then reading it. The goal is to lower their temperature to about 104 degrees. This will often prevent overshooting their normal body temperature of 101 to 102 degrees. They should still be transported to the veterinary hospital, as there are many serious side effects they may experience as a result of heat stroke. Hypothermia is a lowering of the body temperature due to exposure to very cold weather. The severity of cold an animal can endure has a lot to do with the thickness of their coat and whether or not they are used to the cold temperatures on a regular basis. These animals will be very depressed and will have a body temperature below 98 degrees. The thermometer will need to be completely shaken down in order to get an accurate reading. Animals with short hair coats and very young or very old animals are more prone to this condition. Prevention is key and is best accomplished by limiting the pet's exposure to the severe elements. First aid involves slow warming of these patients. They should be warmed by passive measures until they arrive at the veterinary hospital. This is best accomplished by simply wrapping them in a blanket or thermal blanket. Don't attempt to apply external heat sources onto the pet, as this will likely do more harm than good. Just wrap them in a blanket and get them to a veterinarian. Vomiting and diarrhea are not that uncommon among dogs and cats. A single episode of either one of these conditions does not necessarily signal an emergency situation. However, there are certain signals that pet owners should watch for that may indicate the need for emergency intervention. Here is a summation of situations that should be seen right away by a veterinarian. When vomiting and diarrhea are both present. When either the diarrhea or vomit contains blood in it. When the diarrhea persists for more than 24 hours. When the vomiting occurs multiple times. When the diarrhea or vomiting is occurring in a very young or very old patient. When the animal has a history of other medical conditions that make the presence of vomiting or diarrhea more significant. When the animal is running a fever or is very lethargic. Though these conditions may occur together in the same patient, they may also occur independently. Let's examine each condition briefly, beginning with diarrhea. Diarrhea is noted as a varying degree of softness to the animal's stools. When the intestine does not adequately absorb necessary fluids from the stool, excess fluid remains with the stool, making it soft or runny. This lack of reabsorption may lead to dehydration if it persists. A very watery stool should be treated with more urgency, as this condition will more quickly lead to dehydration of the animal. Diarrhea can be caused as a result of eating the wrong things, parasites in the digestive tract, infections of the digestive tract, or many other disease conditions. First aid for diarrhea may involve the pet owner attempting to manage the problem at home in its beginning stages. This may be accomplished by offering a bland diet to the patient. Boiled chicken or hamburger mixed with rice is one possible bland diet you can offer, or your veterinarian has some excellent bland diets they can prescribe. If the owner wants to give anti-diarrhea medication such as kaopectate, then you should consult the veterinarian about the acceptability of this on a case-by-case basis. If the home treatments are not successful, they should see a veterinarian. It is helpful to bring along a small specimen of the stool sample to the veterinarian for diagnostic testing. Vomiting may likewise be caused by any number of things, such as inappropriate diet, eating foreign objects such as string or thread, parasites or worms, or many other illnesses. First aid for the vomiting pet may also be attempted at home if the pet has been relatively healthy and does not qualify as needing emergency care based on the previously mentioned list. Begin by withholding food and water from these patients for at least 8 to 12 hours. Food or water in the stomach will often reinitiate the vomiting process. If no additional vomiting occurs, then slowly begin offering water in limited quantities. This can be easily regulated by offering the pet ice chips to chew on as a slow source of water. Repeat this process for several hours before attempting to feed them anything. Then offer very small quantities of a bland diet, such as the one described for an animal with diarrhea. It is very important not to overdo the offering of food too quickly. Slowly increase the amount offered every 4 to 6 hours, monitoring for any reoccurrence of vomiting. If the vomiting reoccurs, the pet should see a veterinarian. If the vomiting does not reoccur, begin weaning the pet back to its normal diet after several days on the bland diet. Do not make sudden switches in the diet, but gradually decrease the bland diet while increasing the regular food.